Thank you for taking the time to complete Person First Disability Awareness training today. This training assists you to build your knowledge, skills, and confidence to support people with disability in a person first, respectful, and collaborative way. You will be provided the opportunity to download this presentation and further resources at the conclusion of the training. During today's training, we will take a look at patient centered care, person first language, avoiding assumptions, reasonable adjustment, health literacy, and interpreters. We will explore the importance of each of these concepts when supporting people with disability and provide you with tools to implement them. Let's start by taking a look at patient centered care. Patient centered care is most likely not a new concept for you. However, it is super important when supporting patients with disability, so it's useful to do a quick refresh on the principles today. Patient centered care is care that is respectful of and responsive to the preferences, needs, and values of the individual patient. Health staff work alongside the patient and their supporters in partnership to deliver safe, high quality healthcare that better meets the needs of the patient. There are many benefits of patient centered care for both the patient and health staff supporting them. Patients experience decreased anxiety and emotional distress, accelerated recovery time, and greater trust and confidence in the health system. Health staff experience a stronger bond with the patient and their supporters, more efficient and effective use of resources, and enhanced professional satisfaction. Patient centered care is a win for everyone. This slide takes you through the principles of patient centered care. The first one is communication, and it's about having a conversation with the patient and really listening to them. Collaboration is where we actively work in partnership with the patient to better meet their needs and achieve their health goals. Inclusion is about including the patient in all aspects of their care, placing them at the centre of the health journey. Choice is really important, and it's about providing the patient with choices and respecting their informed decisions. Dignity and respect are human rights that are important for everyone, so we need to be respectful of the patient's feelings and perspectives. Openness is about being transparent, honest, and approachable. It's also about communicating clearly and actively listening to the patient. The last principle of patient centered care is holistic care. This is where we look beyond the patient's condition or disability and consider the whole person. I encourage you to download this resource at the conclusion of the training and take a few minutes to reflect on each of the principles. Reflection is a great way to improve our practice. Spend a few minutes thinking of a recent occasion where you demonstrated the principles really well, and then think of an occasion for each where you could have improved your practice. Let's move on to the concept of person first language. Person first language is the respectful and strengths based way to speak to people with disability. It puts the person first before the disability. It is important to also use respectful language when the person is not around, such as when we are talking with colleagues about the person. Person first language is important because people with disability are not defined by their disability, and using this language ensures we don't dehumanise or devalue them. This slide presents person first language principles that you should follow when supporting a person with disability, unless you are advised otherwise by the person themselves. Refer to the person first before mention of the disability. For example, say a person with autism or a person who uses a wheelchair. There are exceptions. For example, a person with autism may refer to themselves as an autistic person. However, as mentioned, it's best to follow these principles unless advised otherwise. Avoid negative language that portrays the person as a victim. So rather than say a cerebral palsy victim, say a person with cerebral palsy. Do not use offensive language or outdated terms, such as those mentioned on the slide. Don't portray people with disability as inspirational or heroic only because of their disability. Many people with disability don't like to be singled out because of this and are simply living their lives like everyone else. It's important to emphasize abilities rather than limitations. So rather than say a person who can't speak, say a person who uses a device to speak. Finally, emphasize the need for accessibility rather than the disability. For example, accessible toilet rather than disabled toilet, or accessible parking rather than disabled parking. If you are unsure how a person would like to be described, you can ask them in a respectful way. As mentioned previously, following these principles will likely have you on the right path. Our problem solving brains don't like to have gaps in information, so we easily make assumptions to fill these gaps. Assumptions, however, are often incorrect, so it's really important to be mindful of what we know for certain and what we have assumed. Many assumptions are made about people with disability that are not true. Some commonly made incorrect assumptions appear on this slide. It's really important to avoid making assumptions about people with disability. If there is something you need to know, ask in a respectful way. To help us avoid assumptions, we should remember that people with disability are not all the same, that each person's experience of disability is different, and that people are not defined by their disability, but rather they are much more than this one thing. We need to look beyond the disability at the person first and don't assume things. Instead, ask in a respectful way. Let's take a look at reasonable adjustment. Reasonable adjustment is about changing, reducing, or removing barriers people with disability experience with accessing services. It's about doing things differently to ensure the person with disability is not disadvantaged or harmed in any way. We may need to support a patient with disability with reasonable adjustments when they are in our care, to ensure they are supported in a way that meets their needs and doesn't cause disadvantage or harm. Some examples of reasonable adjustment include using an interpreter to support communication, using simple language and allowing extra time for processing information to support health literacy, or providing sensory tools to assist a person to settle into their environment. Working with a patient with disability on reasonable adjustments is an easy three-step process. Firstly, ask the person how you can support them. People with disability will often know what it is they need. Secondly, provide the reasonable adjustment that's been discussed. Finally, review the reasonable adjustment to ensure it's meeting the patient's needs. You can repeat this three-step process to provide reasonable adjustment for any challenges experienced by the patient. Implementing reasonable adjustments is not only the right thing to do, but it is also a time-effective exercise. By better meeting the patient's needs and providing appropriate support, we can avoid unnecessary discharge delays or readmissions. Supporting a patient's health literacy is of vital importance. Health literacy relates to how patients understand and apply information about their health and treatment. The actions of health staff and the responsiveness of the health system impact a patient's health literacy. We need to do everything we can to support and improve the health literacy of our patients. Poor health literacy has serious consequences, including medication errors and poor management of health conditions. Very concerningly, 60% of Australians have a low level of health literacy. So let's ensure we do everything we can to turn this around. Let's take a look at the simple ways we can support a patient's health literacy. In our work roles, we often use jargon and acronyms without even realising we are doing it. It's important to be aware of this and use simple language when communicating with patients. Simplify the information as much as you can and use easy read information where possible. Check the person has understood the information by asking them to explain it back to you. And because we all take in and process information differently, use multiple communication methods, including verbal, written, demonstration, and pictures. Ensuring we do these things will support patients to better understand their health and treatment and achieve better outcomes for everyone. Let's finish off today's training by taking a quick look at the importance of interpreters. Using interpreters where required is so important, and this includes using an Auslan interpreter for patients who are deaf and use Auslan to communicate. Patients have the right to communicate in their first language and the right to access free, confidential, and professional interpreters in the health setting. Using an interpreter where required ensures we provide accessible, safe, and high quality care and avoid the serious consequences and poor health outcomes that may arise when we fail to use an interpreter. We need to use an interpreter in any healthcare situation where communication is essential and the patient is not fluent in English. Again, this includes patients who are deaf and use Auslan to communicate. Please do not use the patient's family members or friends as interpreters. There are many reasons this should not be done. Arranging an interpreter is easy and can be done by calling the phone number on this slide. This slide is one of the many resources available for you to download and print at the end of the training. So please do so and keep it handy for the next time you need to book an interpreter for a patient. That concludes the slides section of the Person First Disability Awareness Training. But now, let's hear from people with lived experience of disability and disability advocates about the importance of some of the concepts we explored today.
Inclusion to me is about having environments and persons that are accommodating to others around them and that think about other people. So for me, inclusion is also about kindness.
In general, people say, give people, equal access. But you actually need to often provide things that the rest of the population might not get for them to actually be able to access things equitably. Earmuffs in general, to have them there available for everybody. People won't use them if they don't need them, but it'll make a huge difference for those children that do need them. So inclusion to me means making sure that everyone is catered for.
I think person-centered is when, rather than looking for cookie-cutter solutions or the thing that works for the most people, still using that, but I guess looking for ways that can potentially be adjusted for this person, because not everyone's the same, right? So we always need different solutions.
Person first language, so everyone has their own preferences. If you're in a wheelchair, you don't want to be called, the wheelchair person.
I think just understanding that people do have their preferences with this and just knowing what that is, maybe just clarifying with that person, how would you prefer that we address you or address your child's disability, just so you get that perspective from that person.
I think assumptions aren't always the worst thing in the world, because they often come from what we notice as commonalities and like pattern recognition and things. I think the problem can be that when we treat those assumptions as the be all and end all of the fact about, how we're going to work with someone or what behaviors that person might present with or whatever. So I think that assumptions can be helpful in informing like our general approach to things. But I think when it comes to working with an individual, it's important to remember that we don't all fit the same kind of cloth.
My husband, he does have really high anxiety and is a slight intellectual disability. He often nod and smile at you, but he doesn't actually understand what's happening. And don't make assumptions that they understand you necessarily. Like often then say, for instance, with discharge and home care, say, just double checking what you're going to do when you get home. And can you let me know when will you need to come back into hospital? And that's clarifying their understanding of that they fully understood what you're saying.
I think reasonable adjustments are so important because it's in the foundations of equity itself. It's about making sure that everyone gets what they need to be able to achieve what they need to achieve. And what I need is different from what you need. And I think, again, it brings it back to being an individual. But it's more than we make reasonable adjustments for ourselves every day. And I think extending that to the people that we work with or people that we care for is moving towards a more equitable society.
So other reasonable adjustments could be allowing them to have like weighted blankets or to sleep with weighted blankets. So even if then it's, you know, maybe just over their legs or something like that. So sometimes when we have control of our sensory input, it lessens the anxiety of what we don't have control of.
I think health literacy is really important because you've all probably heard the quote that any sufficiently advanced technology would look like magic to someone who's never experienced that before. I think it's the same with health stuff, right? Like people don't always know exactly what's in the little magic pills that make you feel better, or what's going on behind the scenes, or what it means when someone's doing, you know, different types of surgery, because we don't all know the ins and outs of our own body, and magic's mystifying, right? So just being able to grasp even a little bit more will make people feel comfortable with what's going on.
Health literacy with people with disability is just so important. The way I see it is it's an investment. Giving people that information really is an investment in time, because it's going to essentially save you down the track when you've already alleviated that fear or that stress or that anxiety, and they already know what to expect.
Communicating with persons with disability in a way that they can understand is undeniably important. If someone came to you and was speaking to you, you're an English-speaking Aussie, someone came to you speaking about something that can change your life, but spoke to you in French, and how helpful is that? It's not helpful at all. If you were someone from the deaf community and you didn't have someone who utilises Auslan, you're left in the dark. And I think making sure that the language that is used with people with disabilities, the easy English, whatever method that it needs to come through, I think if you're not going to communicate in a way that's understood, then why communicate at all?
So for the child and the parent to understand exactly what the nurses are saying. So last time we were in hospital, they said to my daughter, if a hematoma comes up, you know, come straight back. And she panicked going, I'm going to get a hematoma. What's that? But she was talking to me like on the way out. And because I knew what it was, I was able to explain. But if it had been my husband that had taken her into hospital, they'd both be panicking about what a hematoma was. And they'd probably be, you know, Googling all these things about, you know, that she's dying on the car ride home, and have absolutely no idea. So just taking down the jargon, and saying it in very layman terms, exactly what to look out for, exactly what things mean, because we can catastrophize what a hematoma is.
Take the time, speak to people, hear them, listen to what they need. If you are able to assist them with what they need, then at the end of the day, the stay in hospital, the visit to hospital is going to go much more smoothly. People are going to recover better, faster, which in the end is going to make everyone's job easier. I think, remember, people are individuals, that everyone is different. Just because some of us do things a different way doesn't mean that we're smaller than or less than. We're just as important.